In this video, we will explore inguinal hernias, a common medical condition that affects many individuals across the globe. An inguinal hernia occurs when tissue, such as a part of the intestine, protrudes through a weak spot in the abdominal muscles, specifically in the inguinal canal, located in the groin region. Understanding the anatomy involved helps clarify how these hernias develop. The inguinal canal is a passage in the lower abdominal wall that houses the spermatic cord in males and the round ligament in females. Inguinal hernias are classified into two main categories, indirect and direct. An indirect inguinal hernia is the most common type and typically occurs in males. It results from a natural weakness in the abdominal wall as the inguinal canal doesn't close properly during fetal development. This type can also occur at any age, affecting both males and females, particularly children. On the other hand, direct inguinal hernias usually develop in older adults due to wear and tear on the abdominal muscles over time. They occur as a result of increased pressure within the abdomen combined with weakened muscles. Now that we know what inguinal hernias are and how they occur, let's discuss the risk factors associated with them. Key risk factors include age, as aging can weaken the abdominal wall, gender, as males are at higher risk, family history, where a genetic predisposition can play a role, and certain lifestyle factors such as obesity, heavy lifting, and chronic coughing that can increase abdominal pressure. Symptoms of an inguinal hernia can vary, but many individuals report a noticeable bulge in the groin or scrotum that may become more prominent when standing, coughing, or straining. Other symptoms can include discomfort or pain in the groin, especially during activities such as lifting or exercising. In some cases, a hernia may not cause significant discomfort, but it can lead to complications. A serious complication occurs when the herniated tissue becomes trapped and loses its blood supply, known as incarceration or strangulation, which requires immediate medical attention. Diagnosis of an inguinal hernia typically begins with a physical examination by a healthcare provider. The doctor will look for the bulge and may ask you to cough or perform other movements to evaluate the hernia. Imaging tests, like an ultrasound or a CT scan, may be ordered if the diagnosis is uncertain or to assess the extent of the hernia. When it comes to treatment, surgery is the primary option for addressing inguinal hernias. There are two main surgical techniques, open surgery and laparoscopic surgery. During open surgery, a larger incision is made to repair the hernia, whereas laparoscopic surgery uses smaller incisions and specialized instruments for a less invasive approach. Both methods aim to push the protruding tissue back into place and strengthen the abdominal wall, often using mesh to provide additional support. Recovery from hernia surgery varies from person to person but generally involves rest and gradual return to normal activities. Patients are usually advised to avoid heavy lifting and strenuous activities for a period following the procedure, and to follow their surgeon's instructions to minimize complications. While most people recover fully and can return to their usual routines, there are potential risks associated with the surgery, including infection, bleeding, and recurrence of the hernia. Now, let's address some common myths surrounding inguinal hernias. One misconception is that hernias are caused solely by heavy lifting. While heavy lifting can contribute to the development of hernias, other factors, such as genetics and muscle weakness, are also significant. Another myth is that hernias will heal on their own. Unfortunately, inguinal hernias do not self-resolve. Hence, seeking medical evaluation and treatment is essential to prevent complications. In conclusion, an inguinal hernia is a common condition that occurs due to a weakness in the abdominal wall, leading to the protrusion of tissue. Recognizing the symptoms, understanding the risk factors, and seeking medical treatment are crucial for managing the condition effectively and preventing complications. If you suspect that you or someone you know may have an inguinal hernia, it's essential to consult with a healthcare professional for appropriate diagnosis and treatment options. Thank you for watching, and we hope you found this information helpful. If you have any questions or comments, feel free to leave them below. Please remember to subscribe for more informative videos on medical topics.